Hello everyone, let's try to solve this question together. So here we have a 3-day-old 25-week preterm infant, and he's reported to have blood in the endotracheal tube. The chest x-ray a day prior is shown in A, and the repeat x-ray is B. The mother has a history of upper respiratory tract infection and group B streptococcus positive UTI. The most likely diagnosis is, pause the slide, zoom the pictures. Okay, the correct response here is pulmonary hemorrhage. As you guys can see that this patient is intubated and it remains intubated. Seeing blood in the ET tube is kind of classic in extreme premature babies, suggesting that there is a PDA which is putting left to right shunt, and a lot of blood is coming, causing the pulmonary hemorrhage. So that is a very classic presentation. But always try to eliminate pneumonia, because pneumonia can mimic hemorrhage. Like there is a history of URI and GBS, and the x-ray, if you see, it's like almost total white out, and that can present, pneumonia can present like this. So that's a possibility. But again, having blood in the ET tube is, like I said, is classical for hemorrhage, and one should look for that. Ventilator failure could be a possibility, but the patient remain intubated. As you guys can see, tube is there, and there are other alarming features that could be noticed. And why blood? So basically, in all, the blood in the DT tube in a premature baby is classic of pulmonary hemorrhage. So what is the management of pulmonary hemorrhage? Let's go to the next slide. So this is a nice article if you guys have time to review, and this is the article talk about differentiating between pulmonary hemorrhage and pneumonias. If you have time, both are available online. So basically 3 points you have to remember in pulmonary hemorrhage. One, of course, try to increase the PEEP, because increasing the PEEP will provide like an stenting pressure, and then this PEEP will be important in keeping the alveoli open and creating like a tamponade on the pulmonary artery. So one is PEEP. The second one is epinephrine. So you guys can use epi if needed. So second one is epi, but again, use of epi is controversial. But in acute scenario when the blood is still going on, you can use epi. The third one is surfactant, that you guys can use surfactant, because what happened, the blood deactivates the surfactant. So surfactant could be used in hemorrhage. The other thing, look for another problem, like see if the baby received vitamin K or not. If baby has received vitamin K, then it's a different scenario. Always look for other pathology. Look for PT, PTT, and coagulation disorder. Look at the CBC for platelets. So these are the important differential diagnoses and things you can manage. Sometime you have to transfuse the baby FFP and cryoprecipitate depending upon how severe the bleed is. But you start with the PEEP. Most of the time is take care, use epinephrine, use surfactant, and these are the journal measures you have to be careful about. I hope you guys have learned something together today. You guys have a wonderful day. Bye.